Hey guys, it's Alicia from Vita Plana. I call it Vita Plana because I am vlogging about all the different content I consume that interests me and helps me feel like I have a full life. Now, keeping up with this rhyming days of the week thing I have going on, today is Newsday Tuesday. I work in the federal government, so I am obligated to follow the news daily because I find out about changes the same way you do. But today I'm going to focus on the HHS announcements regarding autism, the potential link to Tylenol, and the use of glucagon. Let's start with Tylenol. Now, studies that have suggested this link have been around actually for a long time, but they've been limited by the number of people who participated and what we call confounding factors. Confounding factors are things that are associated with both the cause and the result and are the real reason for the connection between the two. So, for example, let's say kids with autism are more likely to develop fevers. Well, then they would be more likely to get Tylenol, and fevers would be the confounding factor. Now, my son has autism, so I'm pretty well read on the subject and have some personal experience. Kids like my son do have issues with their nervous system, and that can include temperature regulation. At the same time, we shouldn't be so quick to think of Tylenol as something that's incredibly benign just because it's used all the time. I have 6 years of pharmacovigilance experience, meaning my job is to monitor the safety of drug products. And I can tell you that there's kind of this running joke in PV that Tylenol probably wouldn't get approved if it came out today. We don't really know its exact mechanism. It has serious consequences on your liver. But at the same time, it's been around for so long that we have a lot of real world safety data. And we could say, yes, this is an expected result of using the drug, or no, this is not. So what does all this mean? It means we have to do more research. It means we should probably do what Dr. Prasad and others at the FDA have always been advocating for time and again, which is randomized controlled trials. It's a study that specifically adjusts for confounders. All right, so let's talk about leucovorin now. Leucovorin is also known as folate or B9. It is a vitamin. And for this particular vitamin, when you're deficient, you develop neurologic symptoms. And that would happen in anyone, child to adult. But in utero, meaning before babies are born, when they're still in the womb, it's really crucial to proper development. So much so that we've passed public health measures to add folate to fortify rice, breads, and cereals. Having a folate deficiency as a result is actually really rare in the US, and it's certainly more rare than having autism. But the new FDA recommendation is based on a study where they found some kids who had folate deficiency who got better when they were given leucovorin, and that makes sense, right? I don't have autism, but I would get better if you gave me the very vitamin that I'm deficient in. But curing my vitamin deficiency wouldn't cure my ADD or diabetes or all these other diseases. And honestly, it probably won't cure the autism in these children, but I can see how it would make them feel better. This leads me to a subject that has to be a whole nother video, which is why are we so quick to fix neurodivergent people when being neurodivergent is the reason why we have so many leaders we have today, like doctors and CEOs and politicians. If that subject interests you, tune into Saturday's video, but tomorrow we'll be doing Friends Day Wednesday. Until then, see you.